for our skeletal system, for our connective tissue. And so he tied this in. That's why I always like to give homage to the pioneers that paved the way for us today.
Absolutely, and I think that's why we're seeing so much problems in today's day and age as well, is because of just how depleted these mineral sources are in the soil, and that's what, again, you and I talked about, and that's why we're seeing so much of these health epidemics. So as far as hair tissue mineral analysis, how does that relate to what you do?
The hair tissue mineral analysis is such an amazing tool because it gives me a window into your biochemistry. It lets me see the minerals, the mineral ratios, and the toxic metals. So we know that, simply put, minerals are necessary for every single body function to work. Every enzymatic process in the human body in the creation of energy is dependent upon these nutrient minerals. And so when we look at the action potential of a cell, sodium, potassium, that creates the charge to allow things to come in and things to come out of the cell. So when we understand how these nutrient minerals are so vital for human health, and so this is why I looked at this so seriously, because no one else really connected all the dots, and I was just looking at this, and it's absolutely amazing. So hair tissue mineral analysis really is the blueprint into your biochemistry. It shows me where your minerals are at. It shows me where your toxic metals are at.
Yeah, and again, we had talked about that earlier, Robert, where talking about basically, I used to get so mad because no one accepts adrenal fatigue as a legitimate diagnosis, and then I suffered it with it myself. And then the next thing you know, I'm on a mission to, tell the world that there's such a thing as adrenal fatigue. But then the more research I did and the more I looked into it, it was a deeper level. The deeper level was that the mitochondria, the area of the cell that produces the energy, is really fundamentally breaking down. And if you look at, biochemistry 101 and electron transport chain and oxidation phosphorylation, Krebs cycle, pretty much the vitamins and the minerals, and as you mentioned earlier, the minerals really are needed to potentiate or activate the vitamins. We're looking at ground zero fundamental level for producing energy, and we're not just talking about energy for going out for a jog or a run. We're talking about energy for basic production like cell function, heart beating, respiratory function, detox, reproduction, regenerating tissue, making hormones, making neurotransmitters, all of the above, right?
All of the above. When you think of making that ATP, the ATP, that's the money that drives the energy so we can grow our hair, digest our food, deal with the infections, keep the heart and brain functioning. Magnesium is, there's 22 steps in that whole electron transport, from glycolysis to Krebs to the electron transport. 22 steps. 12 out of those 22 steps require magnesium. And so we haven't really been schooled in the biochemical textbooks on how important this nutrient mineral is. And that's just one mineral in the process of making energy. So the nutrient minerals run the show.
Right, but yet here we are talking about copper toxicity. So it's, as you've mentioned on the periodic table, one of the most important elements for really regulating our energy production. So let's go further. Let's talk about the action potential in mineral.
Sure. The four beetles that are responsible for making a nerve work is sodium, potassium, calcium, and magnesium. This is when sodium, potassium is the charge, those are the two monovalent minerals that charge the cell. That sends the action potential so calcium can rush into the cell, and then calcium is going to release the neurotransmitter. Now, most medical textbooks keep magnesium out of this picture because in those neurotransmitters such as dopamine, GABA, adrenaline, whatever the neurotransmitter is, it needs an energy source. That energy source comes from the mitochondria. In the mitochondria is magnesium. Magnesium is responsible for the mitochondria, so we can make the neurotransmitters. So that calcium-magnesium ratio becomes absolutely imperative for human health because, that's affecting the heart rhythm, the brain rhythms, and when that goes off fine, that can be your heart attack. That can be, the brain going crazy in its electrical wiring. So this is paramount to human health.
Yeah, and you know what? So then let me play devil's advocate then. So why don't we just look at blood tests and look at the metabolic profile and see that the magnesium and the calcium and the sodium are all normalized and that they're doing fine? What's going on there?
Yeah, that's an interesting one because when you go for your blood test, they look at your electrolytes. They always come back clean, and unless you're 2 minutes from death, then there may be some aberrant mineral patterns. But usually in the general public, everyone's electrolytes come back, and that's because the biochemistry happens in the cell. 95% of the nutrient minerals are intracellular. 1 to 2%, like magnesium, 98% of the magnesium is in the cell. 1 to 2% is in the blood. So when they're doing the blood test, they're looking at that 1 to 2%. I want to know what's going on with that 98%. And that's why the hair tissue, which is a biopsy, it's a tissue biopsy, which would be identical to a liver biopsy telling us the mineral matrix and where they're at. And so blood doesn't come close to telling us what is going on, because the biochemistry is in the cells, not the blood. The blood does tell us things about cholesterol, about liver enzymes, about inflammatory markers, about anemias, leukemia. So blood is still a good diagnostic tool, but when it comes to the nutrient minerals that run our biochemistry, it doesn't touch it. This is why hair tissue mineral analysis is the gold standard for determining the nutrient minerals in the body.
Amazing, and yet it's seldom being done. And so anyways, you have a couple quotes here just to to state how important these minerals are for human health. Why don't you give us what you found?
This is one of my favorite quotes. Linus Pauling won the Nobel Prize 2 times. In the history of humanity, there have been 4 people who have won the Nobel Prize 2 times. So this man is a heavy hitter in the scientific world. And his quote that I love to always use, he says, "You can trace every sickness, every disease, and every ailment to a mineral deficiency." Now that's coming from a well-schooled man, 2-time Nobel Prize winner, Linus Pauling.
So why do you think, with the healthcare, because I know we could probably go on a tangent and talk about all the bad things that traditional medicine does, and let's not get it wrong in terms of with acute-based care, they do some great stuff, but when you have a chronic-based problem with what we're seeing in today's environment and how toxic it is, and chemicals and solvents and pesticides and sprays and heavy metals and toxins and all that stuff, why do you think minerals are not being talked about if, some of these heavy hitters back in the day were talking about how important they were, and now we're not really knowing too much about them? We're not focusing on that.
Yeah, the MD stands for mineral deficient, but, and it's affecting their thinking. But ultimately it comes down to you can't patent a mineral, so there's no profit margin in minerals. When a woman has preeclampsia in the emergency room while she's delivering a baby, which is hypertension and seizures, the medical doctor cannot administer a drug because he'll have a lawsuit on his hand. The only thing he can do is IV drip of magnesium, and it works like a charm. So we have been using these nutrient minerals in medicine, but again, the profit isn't there, so they keep that out of the equation, and they keep it on the hush-hush, because Big Pharma is controlling many things in this day and age, and you're up to school on that.
Yeah, no, absolutely, and that's the sad thing that we're seeing, because you and I both see really sick people, and unfortunately, a lot of the testing that we do is not covered with traditional medicine's insurance-based sickness model, and yet what we do is really get to the root cause of the problem, and we can get really political as to why medicine treats with certain drugs and do certain tests and don't allow other tests, and that's a story for a whole other workshop. So, but anyways, let's talk to me a little bit about this quote with the concentration gradient. We kind of talked about 98% of the mineral concentration being inside the cell, but what does that mean in terms of how exchanges are occurring?
You know, the exchanges happen via sodium, potassium, which set the cell permeability is determined by sodium, potassium. So sodium comes in, potassium comes out. That's the charge that opens the gated channels so hormones can come in, so neurotransmitters can come in, insulin, glucose, metabolic waste product, those estrogen metabolites need to come out. And so if we don't charge the cells don't work. And so, this quote by Dr. Tebrazian, I can't even pronounce his name, he pointed out that magnesium, it's a 700 to 1 gradient where you have 700 ions of intracellular magnesium to 1 ion in the blood. So this is why we got to have a deeper concept of how important the hair tissue is, and being able to look at the mineral matrix to see how well the body is really utilizing these nutrient minerals for so many biochemical functions, for health.
No, absolutely, and so that's we're talking about the mineral concentration. So tell us. Well, we've talked about this, right? About the minerals intracellularly. Why don't you tell us about how hair tissue mineral analysis overcomes these problems? Because it's one thing to know that intracellularly the minerals are inside there, and the blood only has 2% potentially. How do we know? What does hair tissue mineral analysis actually do?
Yeah, hair gives us the blueprint of what's going on. The minerals just don't deposit randomly in the hair follicle. And so when we get a hair sample, there's been numerous studies comparing the biopsy of hair to a liver, and they're almost identical. But, doing a liver biopsy, that's a lot more costly, a lot more painful. Clipping the hair, that's a piece of cake. So, with the correct sampling, it's a simple and highly accurate way to test the tissue mineral levels by using the science of micromass spectrophotometry. This is a science that needs to be understood. So hair grows from the inside to the outside of the cell, so it accurately reflects the intracellular mineral content of our bodies. So it really gives us the blueprint into your nervous system, hormonal system, immune system, and that's what's so amazing about it. It is a phenomenal test.
And again, tell us why more doctors aren't doing this then?
They're not schooled in it first and foremost, and the EPA knew, the Environmental Protection Agency, when they're testing toxic metals, they know that hair tissue is the gold standard. However, toxicity is defined by industry, not medicine. So, with all their toxic flagrant fouls in the world, they're not going to be jumping on the bandwagon to point out their flagrant fouls. So this is going to go under the radar. But the pioneering doctors that know about this, they use this tool with amazing insight to see, your health trends, to see where your adrenals are at, your thyroid's at, your blood sugar ratios are at. We can predict so many things by looking at this. That's why it really is an amazing diagnostic tool.
Right, and it's not like this hasn't been around for just a couple of years. I mean, Paul Eck was doing this back in the 50s, no?
Absolutely. This has been an amazing tool for at least over 50 years we've been using this. We know we could put someone to jail with a specimen of hair. So there's so much information that can be gained from hair analysis, and it has to be interpreted intelligently. And so that's why we have to understand ratios. We have to understand the anti-nutrient concept. So there's a lot of basic fundamentals that we have to grasp to truly understand and appreciate the beauty of what this test really can deliver. So it's really understanding the interaction of all the minerals and mineral ratios.
Yeah, you were talking about that, and I think that is a sort of a fascinating point where you're talking about the nutrients and anti-nutrients and how that needs to be assessed properly. So tell us a little bit more about that.
Yeah, the nutrient anti-nutrient is an amazing concept that we need to know about. You can't know about magnesium if you don't know about its antagonistic relationship to the other minerals and metals. So when we look at, let's say we have, in our bank account, we have $10,000 on our bank account, but we need to know, is that really what we have? What about the debt that we have? Maybe we have student loans, maybe we have car things, maybe we have mortgages and all the other debts. So the $10,000 in the bank is a number that tells us that's what we have in cash, but it's not the true status of our wealth because we're not taking into consideration our debt. And it's the same with the nutrient, anti-nutrient. You can't know about zinc if you don't know about copper, if you don't know about cadmium, if you don't know about mercury. So when you look at zinc, it sits under the periodic table, and right under zinc is cadmium and mercury, and to the left of zinc is copper. Copper will displace 8 ions of zinc. Cadmium will displace 100 ions of zinc, and mercury, enemy number one, will displace 1,000 ions of zinc. And we know that zinc is needed for so many functions in the body, and it's this is why we need to understand the anti-nutrient concept.
Gotcha. So just sort of to break it down a little bit easier, because it is a really important concept. We talked about this really. Enzymes are what make reactions happen, and I talked a little bit about the analogies that I like to use, and I do a lot of genetic testing, as you know, and I look at SNPs, which tells us that the enzymes aren't working perfectly, and I say, you know, if you have a SNP where you inherited one faulty gene or altered gene from mom, instead of an 8-lane highway, you have a 4-lane highway. Or I'll say, you know, if you've inherited one faulty gene from dad and from mom, instead of an 8-lane highway, you have a 2-lane highway. But I tell them that I may have an 8-lane highway and you may have a 2-lane highway, and you get to the destination faster than me. Your enzymes may be working better than me. How could that possibly be? You only have 2 lanes and I have 8 lanes. And I use the example of being on a toll pass where you need to have change to go through the toll, and if you don't have those changes, then it doesn't matter if it's 2 lanes or 8 lanes, you're just not going to be able to go through the toll. And the analogy would be such that these minerals are the tolls. They're what really make the enzymes be able to work. Do you find that? And so what we're finding here, what this is, would elaborate, and you can tell me if this is a good analogy, Dr. Rob, is that with these anti-nutrients, it's kind of like the nutrients are the toll, but the anti-nutrients are kind of like having, like, maybe putting a slug in the transponder, or putting a slug in the toll, and it doesn't go in and it just blocks it, and now you can't get anything in there. Is that kind of a good analogy?
Sure is. You know, one of my teachers was telling me he was treating one of his patients with, for cancer, and he was doing an IV drip of vitamin C, because vitamin C is an amazing antioxidant nutrient. And so, we've known about vitamin C in cancer for many years, but he was doing an IV drip vitamin C, and then the woman who got the drip, we were going to check her vitamin C levels in her urine. There was no vitamin C in her urine, and that's because the copper oxidized the vitamin C almost immediately, so that therapy was basically null and void. It didn't get a chance to work because of the pro-oxidant state that copper is and has on these nutrient minerals. So that's a good analogy, what you pointed out. So, yes, we need to understand the anti-nutrient concept to really get the bigger picture.
Right, and given that our society is so toxic, I mean, we have more of these anti-nutrients more available to knock off our nutrients so that they basically take down those receptors so they don't work in effect. Is that correct?
That is correct. And, we know, with the soil science, modern agriculture has used NPK, nitrogen, phosphorus, and toxic potassium. The potassium they use is potassium carbonate. Your body needs potassium bicarbonate. That's a subtle difference, but it's huge in the biochemistry. And then in the NPK soils, they dig up the mercury, the cadmium, and so then all these other heavy metals get into it, and they deplete the soil. If a plant is deficient in zinc, it will look like a plant, smell like a plant, but it'll be stunted in its growth. It won't have an immune system. And if the plant doesn't have an immune system, then industry has to come in with its toxic chemicals to, prevent the insects from eating it away. And then the toxic chemicals that they're spraying on our crops are now getting into the plant. And this is creating, these epidemics of health crises in our country today that we see every day in practice. I know I see it.
Yeah, for sure. And, I was talking to an older patient today. She's actually 88 years old, and she was saying that my generation lives, I'll be 46, 47. We're living to 100, and how our generations are living longer. And I was saying, actually, it's, now our generation, like my kids and our kids' kids, they come out of the womb so toxic because of the vertical transmission when mom is gestating in utero, and she is exposed to so many toxins in our environment from pesticides and formaldehydes and fire retardants and solvents, and it's just and basically what's happening from the cellular level, it's messing up with our mineral concentration levels and causing things like adrenal fatigue. So anyways, what I think is really cool is this slide here, Rob, with talking about how analytical research labs have been doing this for so long that they actually started to see these trends and started to see how ratios from one mineral to another were indicative of certain types of illnesses. Why don't you tell us a little bit about that, and maybe tell us how you've seen that relate to your own practice and people that come in with certain conditions and what you're able to do about that?
Sure. First when we look at the minerals, we look at the quantity and the quality. The quantity is, calcium should be at 40, magnesium should be at 6, and, so forth and so on. So that's the quantity of the mineral. More important is the ratio. That's the quality. And so my example or my analogy is like using time. Time has a quality component and a quantity component. We know a minute is 60 seconds, an hour is 60 minutes, but sometimes that minute, if it's a bad one, can feel like an hour. Sometimes a bad hour can feel like days, and that's the quality of it. So the mineral ratios tell us about the quality. When those mineral ratios deviate from their norm, that's when we start to see the blood sugar ratio, calcium, magnesium. When that hits a 10-to-1, that's prediabetes. That's insulin resistant. Sodium, potassium, one of the most important ratios in human health because that determines the charge on the cell. And then we're going to skip down to zinc, copper. Zinc and copper, that's your hormones, that's your immune system, and it has to be at that 8-to-1 ratio. When that ratio starts to deviate, then we see hormones all over the place. We see compromised immune systems. And so this is why ratios is the quality, the individual mineral is the quantity. Did that make sense?
No, absolutely. So, but can that also be, so if it's too high and or too low, then there's a problem, or is it just if it's too high?
No. If it's too low, it's basically the same thing. It's just like everyone says low blood pressure, oh, you're fine. Low blood pressure is adrenal burnout, so high blood pressure, it's just as bad as low blood pressure. So low blood sugar is just as bad as high blood sugar. So whether it's high or low is just as horrible to human health, whether it's high or low. So we're always trying to achieve the ideal ratios and the ideal numbers. Sometimes a person can have, low sodium and low potassium, but their sodium-potassium ratio is good. Still means they're in burnout, but they're not as bad in burnout as someone with a bad sodium-potassium ratio and low sodium and potassium. So that's why we got to get the whole picture.
Sure. So just sort of skipping ahead and giving a little bit of a glimpse as to what you would do about that. So basically, if you're just doing nutritional medicine, what does that mean? You're trying to restore the proper ratio, so you're going to give a certain nutrient in the ratio that restores that? Tell us a little bit about how that's achieved.
Right. We're going to try to, we have to establish, we have to get the ratios in better ranges. And so we know certain minerals will raise this, some will lower that. So this is why we come in with a nutritional balancing program. And so when we understand where people's ratios and mineral levels are at, we can design intelligently based programs based on their biochemical individuality. So we're not just shooting in the dark. We're hitting the nutritional bullseye like no tomorrow. And so bringing the minerals up or bringing the ratios back down if they're too high, this is imperative if we're going to restore human health.
And I would imagine, too, it's kind of like an exact science, right? I mean, like knowing what minerals displace something, knowing what, what the ratios are, how to get it back up there. The question I would ask, though, is there a priority? So let's say you have like a stress ratio, thyroid ratio, adrenal ratio, metabolic type, hormone ratio, and infection ratio, and 4 of those are off. Is there a priority as to which one you do first, or will one take care of the other? I mean, how does that actually work?
Absolutely. You actually focus on the big 4, calcium, magnesium, sodium, potassium. Those are the all-stars. And so once we look at those as the basic fundamentals, those are the 4 Beatles, they're the all-stars of the mineral matrix. So we know, if sodium is low, we're going to come in with other nutrients that will raise sodium, such as manganese. Manganese raises sodium. So you may have a manganese deficiency, but I'm not going to give you manganese because of your manganese deficiency. I'm giving you manganese to help raise sodium. So this is knowing how these nutrient minerals are synergistic or antagonistic to each other. That's the mineral wheel, the wheel of life, and that's the beauty of this science, and it is truly a science.
Yeah, and you know what? I would love for you to share just sort of some of your case studies. You talked to me a little bit about the was it a bit of the sweating that you were finding with one of your patients? Tell us a little bit about that.
Yeah, this is a great kid. He's like 9 or 10 years old, and his mother was a patient, and she got great results. She came, as a hypothyroid patient, pulled her off her toxic drugs, and so she saw the results. And we were talking about, she was mentioning her kid, how he's having learning disabilities. He was born, basically he could only sweat on half his body side, and he had so many problems at school. So I knew this kid was toxic, and I had a feeling, my hunch was this kid's aluminum toxic. That's why we put aluminum in the deodorants to prevent the sweating. So I knew that aluminum affects the brain and learning, and I knew aluminum has to do with sweating and his inability to sweat on half his body. After putting him on a nutritional balancing program, on his second hair test, we noticed that he had dumped a lot of aluminum. And then he comes into our office and we do a little infrared sauna. And so the first time he could never sweat on that other half of the side of his body. And eventually, with time and the right nutrients, the kid is now sweating. His whole body is sweating, and his mom almost teared up and cried when she saw that. She couldn't believe it. And more importantly, his attitude at school is improving. So he's made an amazing recovery. And that's what makes my day. It's like I love working with the kids because, I have a soft spot for them. And so that was just one example of many, and that was just a beautiful little situation.
That's awesome. And we talked about that earlier for probably those that have sort of maybe not the same type of story where they're only sweating on one side of the body, but you and I both see toxic patients, and, we tell them to do detoxification measures, and they say, for some reason, I can't sweat. No matter what I do, I can't sweat. And we're just basically saying that more than likely is aluminum toxicity, and it blocks your detoxification pathways through your skin to be able to release that. Is that correct?
Right. Your kidneys, your skin is your third kidney. And so when the kidneys are overwhelmed with every toxin has to go through the liver or the kidneys. And, the kidneys are very sensitive organs. And when they become hit with this toxicity, we need to have an outlet to get these toxins out. And this is why we employ, infrared saunas in my office, because that is a way of helping to spare the kidneys without putting stress on it with chelation agents and all that stuff. So we're doing it the old-fashioned way, and it works beautifully. We have to be patient. It takes time, takes the right nutrient minerals, and takes the right, diet to go along with it. So there's a lot of little different components that all kind of, manifest as we're balancing out the nutrient minerals and dealing with this toxic load, because this is the age of toxicity. In human history, we've never seen the likes of it. And this is why 1 out of 2 get cancer, 1 out of 2 die of heart disease, 1 out of 3 is diabetic, 1 out of 6 is depressed. I mean, the list is endless. And so, Houston, we have a problem. If there's a problem, there is always a solution. And the solution really is we got to deal with the the nutritional deficiencies, the nutritional excess, and the toxicity, the metal toxicity. And that's really the basic foundation of my programs.
No, that's incredible. So awesome stuff, and I know we gotta move it along a little bit here, Robert. So molecules of emotion. Tell us a little bit about this slide.
Yeah, no, copper is the most emotional mineral on the periodic table. It's the only mineral that can be in a +1, +2 oxidative state. And so this mineral has to be contained. It needs a control, a check and balance thing, because we absolutely need copper for many, many functions. But when copper goes rogue and starts behaving badly, that's when it's going to be very, acting like a very pro-oxidant state. So when we look at the pH, everything in science is measured with the pH. The hydrogen, is neutral. It's at 0. But we see anything above the hydrogen, that's more electronegative. The more electronegative, the more problems it creates. And so this is why there has to be a check and balance and understanding when that copper goes rogue, it is wreaking havoc on our nervous system, hormonal system, collagen, bones, you name it, it's affecting it. So it's a biggie. That's why I like to throw that slide in there showing how copper really is the most emotional mineral on the periodic table.
No, what do you mean by emotional? You mean it can just go either way? Is that what you mean by the emotional?
Yeah, absolutely. You can go from, if we're not breaking down serotonin quick enough and it's going to, adrenaline, that's going to be the racing mind, the panic attack. That really is the ADD. If we're not making enough of serotonin with the copper, because you need it in that whole MOA, the monoamine oxidase system. And so if it's too much or too little, then we'll either be depressed or we'll have the racing mind. Our bodies will be fatigued because of the adrenal burnout, the thyroid burnout, but our minds will be racing because of the neurotransmitters either being made too quickly or not made quick enough. So that could be the depression on one end of the spectrum or the anxiety, panicky, racing mind on the other end of the spectrum.
Gotcha. All right, so then let's talk about what does adrenals have to do with this, because that's really my area of specialty that's where I'm seeing patients. I'm evaluating their urine analysis or their saliva test, or I'm looking at their 23andMe test. And so, obviously, I call the minerals are obviously the mineral corticoids. So not only do they balance stress and make sure we settle down inflammation and control blood sugar, but they also have to make sure they balance the mineral concentration. So, but going into more with the hair mineral analysis and everything we've talked about so far, what's your take on the adrenals and specifically as it relates to copper dysregulation?
Yeah, absolutely. Now, let me just quickly go over this picture that we have up here. This is slow oxidation. This is actually 80% of the adult population in our country today. They have some variants of this pattern. So we know sodium is mostly an aldosterone response. That's a mineral corticoid made by the adrenals. We know potassium is mostly a cortisol response. That's another hormone made by the adrenals. So sodium and potassium, those are two very fundamental adrenal minerals. And so when we're under inflammation, sodium will spike. That's pro-inflammatory. Aldosterone is pro-inflammatory. To put out the fire of inflammation, cortisol has to rise, and that would be potassium. Now, what happens, inflammation after inflammation, whether it's emotional, whether it's physical, whether it's chemicals or heavy metals or whatever the cause of inflammation, that sodium potassium keeps going up, and eventually it burns out, and then the sodium potassium can't mount an immune response because the adrenals are tanked. And we know the adrenals love magnesium, love vitamin C, love sodium. Those are the nutrients that keep those adrenals, really running. And so when copper starts to behave badly, when copper becomes, the pro-oxidant state, that's going to cause calcium to go high because calcium acts as a deadening agent. It puts the brakes on copper. So calcium is actually quieting down copper. We call that the calcium shell. Sometimes that calcium shell can be an emotional calcium shell where we're walled off. We don't have the energy to deal with things. Or sometimes that calcium shell can be, around the cell, blocking the sodium and potassium. That decreases the cell permeability. So when copper becomes biounavailable, calcium has to go high. When calcium goes high, magnesium modulates calcium. It keeps calcium in check. And if that ratio deviates, then it's going to fry out your brain. It's going to cause, arrhythmias in your heart. And so that ratio has to stay within a pretty, normal range. If it doesn't, you're dead. So when that calcium goes high, magnesium will go high, the sodium, potassium go low. That is adrenal burnout. That is low energy. That is our inability to fight our infections, to heal our bones, to grow our hair, to digest our food. And so this is where 80% of our population are in this pattern, and that's due to this copper toxicity, because copper causes this whole cascade to happen. Did that make sense?
Yeah, no, it does. I'd have to probably listen to that about 3 more times to get right on point with you, but I understand the concept, and I basically, summing it up for everyone that's listening, is that you have all these checks and balances. So the body's just an amazing, incredible, accommodating and machine, and that's what homeostasis is trying to maintain proper mechanisms in the body. But when it goes awry, or when it's constantly being stimulated, and when you're depleting your resources, then ultimately something's got to give, and that's where you see these burnout states. So moving right along, we talked about Dr. Jekyll and Mr. Hyde. Let's just sort of summarize this really quickly, because we kind of talked about this a little bit.
Sure. We know, the emotions. If the neurotransmitter's too high, it's our racing mind. If they're too low, it's our depression. We know that copper is needed for the adrenals. Absolutely. To make thyroid hormone, T1 to T4, T4 is thyroid hormone. The very first step in making T1, tyrosine and iodine, to attach that iodine to the carbon, you need copper. Copper is the most feminine mineral on the periodic table. It has to do everything with sex, with fertility, whether our sex drive is high, whether our sex drive is low. I remember, when I hit puberty, my sex drive was off the charts, but I had the curse of Venus. I didn't have the good look, so I was plagued with that dilemma, and that caused my psyche to be, really compromised in my earlier years. And so it affects our sexual energy. It affects a woman will not be able to hold a child to full term if her estrogen is low and copper is low. Now, you can have low estrogen and still be estrogen dominant. That's why ratios become so critical. And wherever copper goes, estrogen goes. And we know that. And so, this is, when a woman is delivering her baby, calcium goes high, estrogen goes high, copper goes high. After she delivers the baby, the calcium comes down, the estrogen comes down. If the copper doesn't come down, that is your postpartum depression. So it's so involved in all the hormones. Without copper, you can't make the enzyme lactase. And we know this through soil science, because the dairy farmers, when their cows aren't making milk, they'll add more copper, take out the zinc, take out the molybdenum. Hemoglobin. We always think of anemia with iron, but here's the thing. You need copper to turn the ferric to the ferrous and ferrous back to the ferric form. So to incorporate iron into hemoglobin, copper is absolutely necessary. So you can give all the iron to your blue in the face, and that won't touch the anemias until we understand the copper-iron connection. Collagen. Again, soil science, farmers, sheep. When the sheep hears, it's like you can't sell it. It's a weak wool. And so to make the wool, the collagen, to give it its cross-linking, to make it strong, to give it tensile strength, you need copper. So again, here the farmers will add more copper, decrease the molybdenum, decrease the zinc. And so in certain animals, that ratio is good, but in humans, it can be detrimental. And again, we know copper is needed in the energy cycles. 30 to 40% of the energy just in that mitochondria and that whole, electron transport chain. If that copper iron is not in the right ratio, you're going to have a decrease of energy, and I'm leaving out the thyroid and adrenals just on that. In immunity, huge in immunity, and I think we'll get into that in the next slide or two.
Sure, and then Robert, too, we got about 10 minutes left, and we still got to give them a nice little offer at the end here, so let's push it right along. So talking about the basic clinical pharmacology, you talked to me a little bit about this earlier. Why don't we give us a little soundbite on that?
Sure. My teacher, a medical doctor, this was his textbook in medical school, Basic and Clinical Pharmacology. And he took out this quote in his class, that he was teaching to the functional medicine doctors. And this is so interesting. So this is coming from the Bible in medicine, their teaching manuals. Other metal salts such as zinc, sulfur, and copper have significant antimicrobial properties. Antimicrobial, that's your yeast, that's your fungus, all your fungal infections, your yeast infections, the parasites, the hookworms, the viral infections, the bacterial infections, the nanobacteria, the prions. And so we know zinc is more viral, copper is more fungal and bacterial. And this is why they have to be in a good ratio. So when we think of zinc, that's more, viral. Copper is more bacterial fungal. This is why they put copper sulfate in the swimming pools to prevent the spread of athlete's foot. This is why industry will spray copper sulfate on the crops to prevent fungal yeast overgrowth on the crops. We know zinc, you need zinc to activate your white blood cells. So when we have high copper, low zinc, or high mercury and high cadmium and high copper, that zinc becomes deficient, and then we're susceptible to every viral infection under the sun because zinc is needed to activate the white blood cells. So that's the basic gist of that slide.
Well, it just seems so amazing. It seems so paradoxical and so typical, where we're so smart on one hand to know how to, reduce these environmental exposures, or, sort of maximize the dollars for the sheep and for cows or whatever. But when it comes time to actually treating humans, it's like, okay, let's just give them a pharmaceutical. It's crazy,
So agriculture knows, their profit margins are based on this, but in our world of medicine, their profits is based on filling the hospital beds, keeping big pharma and coterie in business. And so this is why there's going to be a paradigm shift. People are getting fed up with this.
All right, so we're going to really sum this part up. I'm going to cut about 10, 15 slides into one or two slides because I do want to get to the end of our offer. And I will guarantee our listeners, who are probably mostly going to be listening to this on the replay, because this is just some phenomenal information that Dr. Robert's giving us, is that we're going to do a part 2. And so we will talk about the estrogen, the progesterone, the cycle long, and how that relates. But let's talk a little bit about copper and the love mineral and the steroid pathway. And basically, let's also try to sum that up as quick and succinct as you can, Dr. Robert.
Yeah, so when we look at, again, cholesterol is the backbone to making all the steroid hormones. And cholesterol is made in the liver. It's a very special fat. So first we have to have good integrity in the liver for the cholesterol synthesis. But going from cholesterol to pregnenolone, that's about 2 steps. If you have a copper toxicity, that's going to antagonize zinc. That's going to knock out the zinc. And then this pathway is going to be compromised. Copper will also block the magnesium. It will oxidize the vitamin E. It will oxidize the vitamin C. And then this creates a metabolic gridlock on the superhighway of hormones. Then we have some hormones high, some hormones low. And this is what's creating, hormone disbalances. This is why we have fertility clinics, weight clinics, why we have, hormones gone crazy. And it's because of this copper toxicity, because it's antagonistic to these nutrient minerals in these pathways. And so that's a very quick, simple explanation.
Yeah, absolutely, and sort of the moral to the story comes back down again to testing your hair, because then you can see the mineral imbalances and then relate it back to the overall characteristic of the case. And, you know, if a patient's dealing with hormonal issues, or she's dealing with insomnia, or she's more aggressive or agitated or anxious, then you can kind of relate it back to the area of enzymatic activity and or steroid synthesis or cell membrane or wherever it may be, and kind of link it back, which is sort of like that moral of the story. Robert, I'm actually going to fast forward. I'm so sorry to do this because I know we had so many good things to talk about, but we are getting close to that 5 minutes left, and I really want to go over some of the things that you have. I twisted your arm so that people can find out how they can get their hair mineral test done for themselves, and what kind of supplements they're going to need, and you really gave them a too good to be true offer. So I hope you don't mind that I'm going to be fast forwarding through all our slides here. You probably want to say something along the way here. What would you say? Why don't you give us a little quick intro on the intro sort of outtake of estrogen and copper connection?
Yeah, when we look at estrogen, we have normal age-related estrogen. We have the phytoestrogens from soy, from hops, from flax, and then we have the xenoestrogens, the hormone disruptors. This is what's tipping the scale to this estrogen-dominant situation, because if we can't dump the estrogens, that's going to keep the baseline copper high, the baseline estrogens high, and that's going to shut off the luteal phase of making progesterone. When we go into low progesterone, that's a nightmare. I mean, we know. And so these xenoestrogens, coupled with a magnesium, zinc, molybdenum, manganese, and vitamin C deficiency, is wreaking havoc on our entire system. So we got to understand how important these xenoestrogens come into this whole picture, because we got to learn how to dump these xenoestrogens. And if we don't dump these xenoestrogens, we're not going to deal with the copper, because copper and estrogen are intimately related. And that's a point I want to really drive home. And we got other, pictures to show, but just time constraints, we'll have to do a part 2 to really pick up on this estrogen.
No, absolutely. We will do a part 2. But, I don't even think we've talked about it. Besides, you talked about having, jaundice when you were born and excess copper. Where are we getting all of this excess copper in the environment? Like, what are some examples?
So in utero, when we're born, these xenoestrogens affect the luteal phase, the corpus luteum. The corpus luteum gets compromised from the get-go, and as a result, progesterone will become insufficient. And then we create this hormonal imbalance from birth. And then, couple that with, as copper bioaccumulates year after year, cycle after cycle, copper is bioaccumulating because there's only so much the liver can store, and wherever you have an estrogen receptor site, copper, the bones, the breast, the brain, so the testicles in male, so this copper will bioaccumulate in a very toxic form, in a very oxidized form, and that will cause complete oxidation of wherever it's being stored. And this creates a metabolic nightmare in us. And so this is why we have to be able to test the levels of these minerals. And what we see in my practice, I see the slow oxidation, the low sodium, the low potassium, and then I see, copper is low, and people think, I just have a copper deficiency. That's because the copper is hidden. It's a hidden copper toxicity, and this is the importance of having a trained eye to pick this out. So we have markers and ways of determining if someone has a hidden copper toxicity, because at the root of the estrogens, at the root of why we have boys turning into girls, why we have, the whole species becoming feminized, if we don't connect these toxic estrogens and copper, we're not going to get to the root of it, and you're going to see so many fertility problems as we're already seeing.
Amazing. All right, well, let's talk about what's next, because This is fascinating stuff for me, and I'm sure for other people. And so let's really talk about what's next. I really twisted your arm to try to give these listeners an awesome opportunity to work with you and work with me together, because I think really one of the things that you and I should really do is try to work together a little bit more in depth on how the genetics and the actual genes code for enzymes, and then the combination of how imbalances impact those enzymes and really create that perfect storm of chaos. But either way, do you agree?
Yeah, because, if we have a copper toxicity and someone has a SNP on the MAO enzyme, that's going to be a double mutant problem. So having a little bit of a genetic, profile, that gives me more insight on how aggressive or less aggressive I need to go with the detoxification. So that becomes imperative in the true bigger scheme of things.
Absolutely. So what we really find is 4 months is a good amount of time to really make some significant changes on these hair tissue mineral analysis testing. So what we've done is we've put together this awesome program where you get to work with both Dr. Robert Selig and myself. And basically what we're going to do is we're going to determine the specific adrenal fatigue and copper individuality that's going to be necessary for you to recover with whatever problem you're dealing with. This is what you get with me. Basically, I'm going to be seeing you 8 times, 30 minutes to 45 minutes twice a month for 4 months. Each time we're going to be doing a metabolic assessment, determining your starting, middle, and ending metabolic performance. That has to do with gallbladder health, liver health, small intestine health, adrenal health, barrier system health, blood sugar health, hormonal health. Also doing a brain health analysis assessment. So this looks at your gut health. This looks at also how your stress and your blood sugar levels are being impacted as well. Then the last thing we'll look at is your brain functional assessment. This is really where the neurotransmitters come in. So I find that this is sort of setting up some of the epigenetic variables, and when I say epigenetic, I mean the environmental stressors that are impacting your brain and your metabolic system. All of those tests together is about a $3,500 value when you work with me. What Robert's done actually is he's done something probably even better than what I've done. He is going to give you 2 HTMA or hair tissue mineral analysis tests. With 1 hour consultation for each one, so you're going to be getting a starting and an end. That's about a $1,975 value. He's going to design a nutritional program based on your test results to match your biochemical individuality, and that's valued at about $1,100. He's also going to personally design a home detox protocol to help you eliminate the metals of disease, and that's valued at $995. A diet based on your biochemical individuality, that's, again, $1,497. And then basically he's going to do nutritional supplements. And this is really the incredible part of it. I mean, this is going above and beyond.
You talked me into it.
Yeah, I talked you into it. Nutritional supplements for 4 months to address so this is turnkey, meaning you're not going to need to buy other supplements. You'll get all the supplements you need for 4 months, nutritional deficiencies and excess, as well as heavy metal toxicities, and that's valued up to $1,500. We don't know exactly what it can be, but it can go that high depending on all the different imbalances that someone may have. And then, of course, email support with Dr. Robert. So that's a value of about $7,000 for that time together, just because you're paying for his training and his expertise and all of these assessments that no one's really telling you about. So if you add all those up together, you have basically my fees that are $3,500 and Dr. Robert's fees that are $7,000. That's about a $10,000 plan. And you know what? That's not cheap. I'm not going to lie, and he's not going to lie. But, and if you could get your health back and you can start playing with your grandchild, or you can know that you're not going to have onset of a dementia problem, or you're going to have a quality of life where you can travel with your spouse, or you can get out of bed because your joints aren't so sore, you have energy to get you through the whole day, or one little stressor doesn't crash you down. I mean, all of these people that are you're not going from doctor to doctor. Heck, I'm sure that you're spending more than this in just doctor's fees alone and medications. And what would it be like to get your life back? I mean, $10,000. I mean, if we asked you right now if you can give us $10,000 and you'd get your health back, would you pay that? I'm sure you'd say yes. But here's the thing: what we've decided to do is we've decided to give you a really, really awesome deal where you pay 4 payments of $997. Or you can pay in full and save an additional 10%. So really, you're looking at $3,500 for about $10,000 worth of care. You're saving about 68%. But the thing is, we can only offer this to 15 people because it takes a lot of our time, and we're really doing this to help you guys at a marginal cost for us to do it. And so I think you'd be crazy to not take advantage of this. You can click on this slide, whether you're listening to it tonight or you're going to be listening to the replay. This slide will be clickable, and it will be offered up until 2 weeks after listening to this replay. And so make sure that you don't miss out on that. Dr. Robert, do you have anything else to say in regards to this offer and anything else that I may have missed?
Yeah, this offer is too good to be true. And what I really want to say, that health truly is the greatest wealth. Without health, we have nothing. And so we're giving you a different perspective, a different paradigm. We're giving you real solutions to real problems. And this is, I've dug myself out of the hole, with my copper toxicity and my adrenal burnout. And so you're getting a real keen eye. I've looked at this for many, many years. So this is the deal of the day. And so, Dr. Joel really twisted my arm to, bring my prices down. And I'm happy to do it because it's opening up the doors for people to see the beauty of hair tissue mineral analysis and nutritional science. So I'm happy about it. So thank you.
You know what I also say too, I don't know why I even thought of this, but I just thought of it right now. Like, go on to Craigslist or go on to Auto Trader and see what kind of car you can get for $35.90. I mean, seriously, see what kind of car you can get for that price. And so that's the price of your health, really. It's not that big of a deal. I mean, it is a lot of money for a lot of people, and we've brought it down to $997, but your health is worth so much more. You can't put a price tag on that, and I think that's what Dr. Robert's saying. And really, this is not a big ticket item for us. This is something that we've put together to try to help people that aren't getting the help that they need and that they desperately need to get. And ultimately, we know by putting good out into the world, that comes back in spades, and that's what we both get a lot of fulfillment out of. So, Dr. Robert, I really, 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 number one, I'm sorry that I cut so many slides out, because I really would just love to have a presentation just with you alone so that I can learn from what you're telling. And I think that's some of the reason why I do this, is because I just want to learn what you have to offer. And then number two, I want to thank you taking time out of your busy schedule, putting this program together, giving people such an awesome deal, making the PowerPoint presentation, and sharing your knowledge. It's such a great thing that you're doing. I want to thank you so much for being on the line tonight.
It was a pleasure, Joel. I really enjoy this, and my life's mission is to really bring awareness to this copper plague of our day, because it's devastated me. I mean, I could spend an hour just talking about my whole health history and how crippling it was for me, but that's another lecture, another thing. But I do hope we have a part 2 where I can actually really show the audience the estrogen copper connection, because I got some beautiful slides to really pinpoint that.
Yeah, and this is what we'll do. I'll send back these slides to you so you can see what I did to butcher your presentation, and then you can reinsert the ones that we didn't talk about, and then I will definitely promote this. But in the meantime, let's try to get this out to all the people that weren't able to get on the call tonight, and we want to give the opportunity for them to be one of the first 15 people. I'm going to be sending this out in the replay. You're going to have up to 2 weeks from listening to this recording that you can still qualify for this awesome deal. And I just hope everyone has a great night. Thank you so much for joining us on the line. And Dr. Robert, thank you so much for donating your time today. I really appreciate it.
It was my pleasure. Thank you, Joel.
All right, Robert. We'll talk to you soon. Have a great evening, okay?
Good night.
All right, good night.